So started a full-time private practice in 1986 and was quickly targeted, recognized as one of the few bilingual therapists in the community, and got a few referrals because of that, but not really that many. In those days, the Latino population in this community was mostly Mexican American and Mexican national, and those populations in those days did not believe in therapy. They were more likely to talk to their priest or minister, or not do anything about mental health or drug and alcohol problems at all unless forced to do so. The few referrals that I got back in those days were largely victims of child sexual abuse whose families didn't speak English. And that was not really my interest or forte, but because I was it in terms of a bilingual therapist, I would see some of these cases, and was quite relieved when in 1994, 95, a bilingual psychologist, a woman from the Dominican Republic, came, educated at Rutgers University with an expertise in child sexual abuse, and she came into the community, and boy, all those referrals went her way. We, excuse me, I should say, some of the community leaders started a task force called the Hispanic Task Force to talk about the health needs of Latinos in the community. And I was asked to be on that task force to represent the mental health side of things. And of course, we came up with a needs assessment and targeted bilingual service providers, and lacking that, decided that we needed translators to work with people who sought services from dentists, family physicians, emergency room physicians, and mental health practitioners. I think we disbanded the task force after about 5 years because it was so darn effective. And we went and I should say that the impetus behind the task force was Maritza Robles, who was my immediate supervisor at the South Bend Community School Corporation Bilingual Education Department. And she is a great organizer and a great administrator. And she got things done and got people in the community to start recognizing that our population, that is this bilingual population, Spanish-speaking population, were in need and were worthy of serving. And the service providers had to be convinced that these weren't all going to be welfare or pro bono cases, but that they would actually, some of them have insurance and some would pay for services, and that's fine, that's acceptable to me. I think that some grants were written and monies were found to provide dental services, for example, for kids, that sort of thing. But by and large, the task force did its job, and those needs of the Hispanic community were met. And so at my suggestion, we disbanded after about 5 years. And sometime later, things picked up again. I guess it was in '99 when the Notre Dame started the Institute for Latino Studies. Started another task force, to assess the needs of the community, and what a difference that institute makes in this community. It brings in nationally recognized scholars, and because of that, I think the interest in this community has gone from local to regional, and the task force, the original task force, was not nearly as large nor as well represented by healthcare professionals, medical doctors, dentists, police officers, that sort of thing. So over the years, I have developed a fairly large caseload of Latin American clients. When I first started out, the majority of clients that I would see were either court or social service referred, mostly Mexican, a few Puerto Ricans, and today I have on my caseload people from Chile, Argentina, Venezuela, Colombia, Mexico, Spain, Nicaragua, Guatemala, Honduras, and I think that covers about all the different places that I've had Latino clients from. And of course, the cultures are very, very different. But interestingly, most of the clients I have are males, which is much different from 20 years ago, when the only way you got a Latino male into the therapy office was with a court referral or some sort of crisis happening. And nowadays, folks are seeing the benefit of therapy and seeking out the services and seeing that it helps them. I'm reminded of a Christmas party I went to when I was working at the state penitentiary in New Mexico, and a friend had their annual December 23rd Christmas party, and I was the only social worker on the psychological services staff at the state penitentiary in New Mexico, and one of 3 Latinos who were on that staff, and went to this Christmas party, and there was a well-dressed Latino guy who was a professional, college educated, and of course, when people find out what I do for a living, they either run the other way or they start asking questions. And this fellow thought it was very curious that I was on the psychological services staff. And he said, "Do you have any Latino inmates who will talk to you?" And I said, "Well, yeah, it's 80% Latino at that institution. Of course I do. Why wouldn't I?" He said, "Well, I wouldn't go talk to you if I needed therapy services." And I said, "Well, really, why not?" He said, "Well, because you're Latino, so you probably didn't go to a very good school. And if you did go to a good school, you were probably affirmative action. So I would think that the white therapists, the white members of that psychological services staff would be better educated than you and better skilled." And of course, I then was able to bring out the old Well, actually, I went to Notre Dame and graduated with honors, and then was awarded a NIMH Hispanics in Mental Health Scholarship at Western Michigan University, and was awarded the Thurgood Marshall Scholarship in my last year. And I told him that not all Latino professionals were affirmative action or poorly educated. So, but back to South Bend, I have really enjoyed the work that I've done with high school kids especially, and I tell them that story about my dad urging me, more than urging, really guilt-tripping me into going to college. And I tell them that if they don't have that support from outside, from home, that they need to develop that drive somehow from within, so that they can use education as a way to have a better life. So.
Can you talk about some of the kids you work with, the different kinds of populations, the different kinds of things you do that might be interesting for kids who would watch this, who might be curious as you were to have a career in mental health?
One of the phenomena that I've noticed is the clash between cultures that occurs when parents, immigrant parents, come to this country with young kids. The young kids develop their language skills more rapidly than their parents. Some of the kids don't realize that their parents are very poorly educated. In Mexico, the public education stops at the 6th grade. So if you want to go beyond 6th grade, you have to pay. And many people that I've worked with have told me that they couldn't afford to go to school after 6th grade, and that they were fortunate if they found work at age 11 or 12, boys especially, who would work maybe sometimes alongside their fathers for no pay. And what happens is you get the kids who assimilate so quickly and lose their Spanish language skills. The parents who don't assimilate because they don't need English language skills to navigate here in this country sometimes. And I have parents who speak in Spanish and kids who respond in English. And oftentimes I act as translator for parents and kids and teach kids about the different cultures and how their parents come from a very different culture, and that they may not support education as much as the kids would like, but that they need to educate their parents that they'll have a better life if they finish high school at least, and an even better life if they go on and do some sort of training beyond high school. So it's always eye-opening to these kids when I ask their parents in front of them how far they went to school. Because oftentimes the parents are interested in the kids doing well in school. And I ask the parents how far they went in school, and some of them come back with they went as far as 3rd grade or 4th grade or something like that. And the kids' eyes get really big, and I ask them and say, what why they did that. Why didn't they go beyond third or fourth grade or sixth grade? And they say it was a matter of money. And why are they here in the United States? Sometimes legally and oftentimes without documentation. And universally, the response is that they came here to have a better life for their families and for their kids. And so the conflict that's going on is unfortunate, because the conflict is with the kids that they want to have a better life for. So, but that the opportunity for a good life is certainly here in the U.S., and it is unfortunate if these kids don't take advantage of the opportunity. I tell them they have a right to at least a 12th grade education, pretty much for no cost. And oftentimes, unfortunately, these kids get caught up in the use of mood-altering substances, casual sex, end up pregnant, drop out of school, get involved in gang activities, that sort of thing, or just have no real interest in finishing their high school educations. Hard-working kids, many of them. One of the kids that I worked with was one of the few kids who passed the Indiana State test. It's called the I-STEP, and it's required to graduate, but kids take this test from the time they enter as ninth graders, and he was one of the few ninth graders in his school who passed it as a ninth grader, and then promptly earned 1 credit in 2 semesters of attending school, and by the end of his second year in high school had a grand total of 3 credits, due largely to absenteeism and having been suspended. He then found a job and quit, and that's a real unfortunate thing, because he's a hard-working kid and certainly plenty bright, but his interest was more in having a car and having a job to support that car than it was in getting an education. So